Welcome to Part 2 of the Doctors in Training 2014 Step 1 Review course. I'm Dr. Brian Jenkins, the founder and president of Doctors in Training and one of the chief educators for the course. Part 2 of the course will review all of the high-yield topics that you need to know to reach your peak score on the USMLE Step 1 or COMLEX Level 1 exam. We know that at this stage in your preparation, your only concern is crushing your exam. So rest assured that you've made a wise choice because we're going to help you do just that. Before we get started, I want to say just a couple of words about how we've designed Part 2 of the course to optimize learning. First of all, long-term retention of information requires both the input and the output of information. One of the reasons Part 2 of our course is so effective is that we ask you questions in order to force you to recall and output that information. This makes your synaptic connections much stronger and more durable. Each Part 2 video begins with a 3-question warm-up that will help you to re-engage and also strengthen your retention of information we've already covered in the course. And we included an end-of-session quiz at the end of each video to review and reinforce the most important, most testable topics covered in that video. Part 2 will feature Chief Educators Mike McGinnis and Chris Lewis, along with several popular physician educators such as Jennifer Shuford and Hampton Richards, who will be putting their knowledge and experience at your disposal. We've also teamed up with Lippincott, Williams & Wilkins, one of the most respected medical publishers, to provide you with more illustrations, diagrams, and clinical images than ever before. Some of these images and illustrations come from the 2014 edition of Step Up to USMLE Step 1. One last comment before we get going. Be sure to take good care of your body during this final period of intense study. Be sure you're eating right and get some daily exercise to relieve stress. And don't neglect adequate sleep, which is extremely important for memory processing, so you can remember everything you're learning. And with that, I'm going to hand it over to one of our chief educators, Dr. Mike McGinnis.
Hi, I'm Dr. Mike McGinnis. I'm an internist and one of the chief educators at DIT. In this video, we're going to start reviewing some basic embryology. But first, I want to introduce a few features of the course. You should have already received your Doctors in Training study guide, which is an integral component of Part 2 of the course, which is where you're going to find all the quiz questions as well as some supplemental information. If you open up the study guide to the table of contents, you'll notice that the course is broken into sections titled Foundations, Neuro, Pharm Basics, Cardiovascular, and so on. Each of those major sections is tabbed on the side of the book. You'll also notice that each of those sections is broken into several chapters, and each chapter corresponds to an individual video. This is the Foundations 1 video. So in a minute when we get started, we'll start with the Foundations 1 chapter called Embryology, which begins on page 3. Now if you skip over to page Roman numeral 9, you'll see our recommended course order. We strongly recommend that you watch the videos in the order that they appear on your personalized dashboard. You have the freedom to view the videos in any order you like, but we've designed the course with a very specific order in mind for a couple of reasons. For starters, we're very deliberate about how we sequence the material in the videos, adding layers of information so that each video builds on the foundation of the previous videos. And the second reason for the recommended course order is that every video begins with a 3-question warm-up quiz that reviews high-yield material that we've already covered. Now, obviously, if you start going out of order, there's no guarantee that the warm-up material will be a review. You might find yourself getting frustrated rather than being reassured that you're actually learning and retaining everything you should be. Then, one last thing before we get started. Back on page Roman numeral 7, at the bottom, there's a table titled Course Viewing Options. This table provides some different options for working through Part 2 of the course, depending on how many days you set aside for Part 2, and how many hours per day you want to spend watching videos. For specific day-to-day advice on what your personal study schedule should look like, you can purchase an individualized study plan from our student advising team. One of the things we found to be true over the past decade is that a key indicator of success is to make a schedule that works for you and then stick with it. So we strongly recommend that you develop a plan to work through Part 2 of the course if you haven't done so already. All right, let's get down to business. This is Foundations 1, and we're going to start with some basic embryology. So open up your study guide to the Foundations tab, and on page 3, you'll see this is the chapter for Foundations, Video 1, and the topic is Embryology. So no matter what page you turn to in the study guide, you can always see exactly what video it goes with. Then, at the beginning of each chapter is a short outline of the material that will be covered in that video. So here at the top of page 3, it says that in Foundations 1, we're going to talk about embryonic development, neurulation, neural crest derivatives, and germ layer derivatives. And then there are some page references listed. Back at the top of page Roman numeral 7, we have a key to abbreviations. we generally provide references to the last couple of editions of First Aid and a page reference to the 2014 edition of Step Up to USMLE Step 1. We'll put those page references at the bottom of the screen for you, and when those topics change, you'll hear this sound. While I'm thinking about it, students have occasionally remarked that they don't always hear that sound, or that certain videos are harder to hear than others. So I want to point out right up front that built-in computer speakers aren't always the greatest, especially at reproducing low-frequency sounds. So if you're having any trouble with the video volume, I would strongly recommend that you try some headphones, which are going to give you a better overall experience. So you've got your headphones, you've got your study guide, you've got your review books, now it's embryology time. So if you want to understand the human body, where better to start than the beginning? You start with conception, which is where a sperm meets an oocyte, and that forms a zygote. So we're starting off really basic. The zygote begins to divide, and as more and more cells accumulate, it becomes a morula. Morula comes from the Latin word for mulberry, and the morula kind of resembles a mulberry. I like to know where some of these medical terms come from because I find it makes it a lot easier to remember them. So we've gone from a zygote to a morula, and then as the morula keeps dividing and growing, it becomes a blastocyst. And the important thing about a blastocyst is that it has an inner cell mass and an outer trophoblast. These two parts of the blastocyst mark the first step towards specialization, where you're taking genetically identical cells and turning them into distinct, specialized tissues that serve different functions that are necessary for the overall well-being of the organism. Now, one of those important functions is the acquisition of energy. Early on, the zygote's only source of energy is whatever energy substrates were stored in the oocyte. But in order to grow and develop, the zygote needs more energy and more nutrients, and eventually it's going to obtain that energy by implanting in the endometrium. Now, implantation takes place on day 6, and the only reason implantation can take place is because of tissue specialization. The trophoblast will become the placenta, and then the inner cell mass will eventually become the fetus. Now, we can loosely categorize specialized tissues as being either providers of energy and matter or establishers of order. For example, talking about energy providers, the lungs provide the organism with oxygen. The GI tract absorbs nutrients and energy substrates like sugars and fats. The liver stores energy in the form of glycogen, and it also generates energy through gluconeogenesis. So those are all providers of energy and matter. And then the other broad category is made up of tissues that establish order. For example, the endocrine system establishes order by regulating biochemical processes. The bones and skin and connective tissue establish order by giving the organism a defined physical shape and structure. And then the brain and the nervous system provide order by controlling and integrating all the functions of the body. So, if specialized tissues are either providers of energy or establishers of order, how does this apply to the blastocyst? Well, the trophoblast focuses on the acquisition of energy from the mother by becoming the placenta. And then the inner cell mass will focus on the establishment of order. But both of these tissues are equally essential to the survival of the organism. So first, let's look at the trophoblast portion of the blastocyst. The trophoblast further specializes into the inner cytotrophoblast and the outer syncytiotrophoblast. The syncytiotrophoblast is responsible for secreting the hormone HCG, which tells the mother's corpus luteum that a successful implantation has taken place, so that the corpus luteum will continue to secrete progesterone, and that progesterone maintains the endometrial lining and prevents menstruation. After implantation, the trophoblast eventually forms what we call the chorion, which grows little finger-like projections called villi, and these chorionic villi grow into the endometrium and become the fetal component of the placenta. The maternal component of the placenta is basically the endometrium that these chorionic villi are invading. We call this maternal component the decidua basalis. And then while we're talking about support structures, there's also a thin layer of tissue called the amnion, which contains the amniotic fluid. And there's something called the yolk sac, which serves as a secondary source of energy, kind of like the adult liver, as well as a source of non-specialized stem cells. We're going to talk about stem cells again in Foundations 9. Now, at the same time that the trophoblast is undergoing specialization to provide energy, that inner cell mass is also specializing to establish order. In week 2, the inner cell mass becomes a 2-layer structure, or a bilaminar disc. Those 2 layers are called the hypoblast and the epiblast. And that 2-layer bilaminar disc doesn't last very long because during week 3, the epiblast will differentiate into a trilaminar disc with 3 distinct germ layers: the ectoderm, the mesoderm, and the endoderm. And this trilaminar disc is also sometimes called a gastrula. And if you look at this chart in number 1 in your study guide, you can see how these 3 germ layers are basically going to become the entire fetus. Now we're going to go through all these different cell types in just a second and talk about which tissues are derived from each of the 3 germ layers. But just to recap how far along we've come, we started with the single-celled zygote, which divided a few times and became a morula. Then the morula became a blastocyst, composed of that inner cell mass and the outer trophoblast. And then the trophoblast invaded the endometrium and will eventually become the placenta. And that inner cell mass becomes a bilaminar disc and then a trilaminar disc with ectoderm, mesoderm, and endoderm. So during weeks 3 through 8, which we call the embryonic period, these 3 germ layers begin to form organs. And it's very important to know for your test which of these germ layers gives rise to these specific organs and tissues and individual cell types. For now, let's focus on the cells that are derived from the neural crest, which arises from the ectoderm. These ectodermal neural crest derivatives are particularly high yield. But first, we need to know what the neural crest is. The neural crest is involved with the very first steps of nervous system development, which is called neurulation, or the formation of a neural tube. Now here's how it works. By the end of the 3rd week of development, you've got your 3 germ layers, the endoderm, the mesoderm, and the ectoderm. And right down the middle of the embryo, some of the mesoderm forms a little longitudinal cord of dense tissue called the notochord. The notochord's job is to induce the ectoderm cells right above it to form something called the neural plate. Then once the neural plate has formed, the edges of it start to fold up and form this neural tube, which will go on to become the brain and the spinal cord. But during that folding process, some of the ectodermal neural plate cells kind of pinch off from the leading edges of the neural plate, and they merge to form a crest of tissue that overlies the neural tube. And this crest of tissue is called the neural crest. So the neural tube and the neural crest are derived from ectoderm, but it's the notochord and the mesoderm that makes it happen. Now, eventually, these ectoderm-derived neural crest cells are going to start to leave the neural crest and migrate to other parts of the embryo as it develops, like little missionaries or little ambassadors whose assignment is to establish order throughout the body. Now take a look at number 2 in your study guide. What neural crest derivatives are found in each of the following adult structures? In the peripheral nervous system, the autonomic nervous system comes from the neural crest, including the vagus nerve and also the sympathetic ganglia. You also get the dorsal root ganglia, the sensory nerves, the Schwann cells, and the cranial nerves. So pretty much your entire peripheral nervous system comes from the neural crest cells. In the ear, the neural crest derivatives are the ossicles of the middle ear, the malleus, the incus, and the stapes. In the eye, you have the structures of your anterior chamber of the eye, including the cornea and the sclera, the ciliary muscle, and even the pigment cells of the iris. So your eye color comes from neural crest cells. In the adrenal gland, the chromaffin cells of the adrenal medulla come from the neural crest. So chromaffin cells are the cells that make the catecholamines like epinephrine and norepinephrine. You can think of the adrenal medulla as being like a big overgrown sympathetic ganglion. We already noted that the sympathetic ganglia come from the neural crest cells. So again, sympathetic stimulation comes from the neural crest. In the mouth, the odontoblasts come from the neural crest. These are cells that play a role in the development of teeth, specifically the dentin of the teeth. So you might remember Crest toothpaste to remember that part of the teeth are derived from the neural crest cells. In the heart, the aorticopulmonary septum, or the spiral septum, comes from the neural crest. We'll see that again in the cardiovascular section when we talk about the development of the heart and how if this spiral septum fails to develop normally, you can either get a truncus arteriosus or transposition of the great vessels. So neural crest derivatives in the heart are important for establishing order. In the digestive system, the neural crest cells form the enteric nervous system, the celiac ganglion, and the enterochromaffin cells that secrete serotonin. These are all important for regulating gut function, which again is establishing order. In the thyroid, neural crest cells give rise to the parafollicular cells of the thyroid, also called the C cells. These are the cells that secrete calcitonin. And in the skin, the neural crest gives rise to the melanocytes. So these are all pretty important to know. I'd say this is a 3 or maybe a 4-star topic. Throughout the course, in addition to saying that this topic is important or that details high yield, we'll occasionally give certain topics a star rating. It's just a shorthand way of telling you what you're more likely to be tested on. So if we say something's a 3-star topic, that means that there's about a 50% chance that you're going to see it on your exam. It's a topic that we know they test on, but only about 50% of students get a test item on it. I mean, the exams aren't identical, right? They have this enormous pool of exam items to select from, but they don't pull the items at random. Certain items, certain topics come up more frequently and are tested more heavily. So a 3-star rating means about 50% of students will see that topic on their actual exam. A 4-star topic means that you should expect to see at least one question on that topic. Now, there's no guarantee, but pretty much every student reports being asked about these 4-star topics. And then 5-star topics are the ones where you should expect multiple test items on that particular topic. So again, neural crest derivatives are a 3 or 4 star topic. There's a better than 50% chance that you're going to be asked to identify one of these cell types as a neural crest derivative. So that's the neural crest. Now what about the other germ layers? Let's finish out the ectoderm. Remember we said that the neural crest comes from the ectoderm, but there are other tissues that come from ectoderm too. We sort of arbitrarily divide the ectoderm into surface ectoderm and neuroectoderm. So neuroectoderm is the neural tube, and it's pretty easy. It gives rise to the central nervous system basically. The neurons of the brain and the spinal cord, the oligodendrocytes that myelinate those CNS neurons, the astrocytes that support the CNS neurons, the ependymal cells that secrete CSF, the optic nerve and the retina, and also the pineal gland and the posterior pituitary or the neurohypophysis. And then the surface ectoderm is the ectodermal tissue that did not become neurological because it did not get influenced by that notochord. But still, I like to think of this as forming a bunch of other structures in the head, like the lenses of the eye, the olfactory epithelium, and the inner ear. So lots of stuff that's related to the special senses. Then some other head structures that come from surface ectoderm are the anterior pituitary, the oral epithelium, and the salivary glands. And then since this is surface ectoderm, it's fairly easy to remember that the epidermis and the sweat glands come from surface ectoderm, and also the mammary glands. So sweat glands, mammary glands, and again the salivary glands. And one more, which is kind of an outlier, is that the portion of the anal canal that's distal to the pectinate line comes from the surface ectoderm. So both extreme ends of the GI tract come from surface ectoderm, the oral epithelium and the distal part of the anal canal. Then moving on to the endodermal structures. Now these are pretty easy too because your endoderm is essentially your gut tube. So your endodermal structures are structures that tend to have less of an order establishing function and more of an energy and matter providing function. This includes the GI tract from the esophagus all the way to the pectinate line in the anus. Now, what germ layer does the anal canal tissue distal to the pectinate line come from? We said it came from the surface ectoderm. Other endoderm-derived tissues include the liver and the gallbladder and the pancreas, which are intimately involved with digestion and energy sharing. Also the lungs, which is supplying energy and matter in the form of oxygen. Also the thymus, the parathyroid gland, and the follicular cells of the thyroid. Also, make note, the epithelium of the bladder and the urethra come from the endoderm, and so does the lower 2/3 of the vagina. So most of the bladder and the urethra are derived from mesoderm, along with the rest of the urinary system, but the bladder epithelium and the urethral epithelium are derived from endoderm. And then mesoderm is basically everything in between the ectoderm and the endoderm. Mesoderm provides a lot of the connective tissue and supports tissues like bone, muscle, bone marrow and blood cells, the heart, the blood vessels, the lymphatics, the upper portion of the vagina. So again, the vagina is derived from both mesoderm and endoderm. The lower portion of the vagina is from the endoderm and the upper portion is from the mesoderm. Also the kidneys and the adrenal cortex, the gonads, and the dermis of the skin. So the bladder epithelium is endodermal, but the kidneys are mesodermal. The epidermis is ectodermal, but the dermis is mesodermal. So that's all the embryology we're going to cover here in Foundations 1. So now we're ready for the end of session quiz. At the end of each video we're going to have a short quiz, usually 3 or 4 questions, to review some of the highest yield material covered in that video. This quiz is going to be found in your study guide. So what I want you to do is to pause the video for a minute or two, try to answer questions 3, 4, and 5 in your study guide. Don't spend too long on them. Then once you've answered those questions, you can restart the video and I'll go over the answers with you. All right, let's go over the answers to the Foundations 1 end of session quiz together. First question, what developmental structure matches each of the following descriptions? So the fetal placental structure that secretes HCG is the syncytial trophoblast, and the maternal component of the placenta is the decidua bassalis. Next, what's the relationship between the notochord, the neural plate, the neural tube, and the neural crest cells? So the notochord is part of the mesoderm, and the notochord induces the nearby ectoderm to form the neural plate. Then the neural plate gives rise to the neural tube and the neural crest cells. And the last question, what is the embryologic origin of each of the following adult structures? So the anterior pituitary arises from surface ectoderm, the cornea comes from the neural crest, the lens comes from surface ectoderm, the retina comes from neuroectoderm, the olfactory epithelium comes from surface ectoderm, and then the mammary glands, the salivary glands, and the sweat glands all come from surface ectoderm. All right, that's it for the quiz. Hope that wasn't too bad. The next video is going to be Foundations 2. We're going to continue talking about embryology and talk about some teratogens. I'll see you then.